السلام عليكم. بسم الله والحمد لله والصلاة والسلام على رسول الله. It will not be like a lecture, and I would love to thank everybody is attending. I'll just take your permission just to share it live. It will not take more than 15 minutes, just talking about our event, which will take place, inshallah, on 25th of September. The main reason behind having this session is just to ensure that everybody is prepared, having a clear understanding of what is the benefit behind this kind of activities. Of course, having the leadership from SGH in this matter, which is value-based healthcare. And the main message today, inshallah, is how value-based healthcare is very crucial for everybody, and ensuring that also our colleagues in quality will start having more focus on value-based healthcare during their career. So I don't know if you can see my slides. I'm sorry. Can you see my slide? Something happened. Okay, sorry. Just to ensure that everybody on the same page, today will not take more than, inshallah, 15 minutes. Just showing our colleagues who is already registered in our conference or going, inshallah, to register, how far this kind of activity is very crucial for our quality and infection control teams in all branches, in all areas. And how far this kind of activity will enrich their skills, and ensuring that again all of us are prepared for the new challenges in quality of healthcare. So I'll start from the title of the conference. So today we as SGH we agreed that we need to link all quality activities towards value-based healthcare, and actually it is not a new thing. It's and as you can know and you can see also that value-based healthcare is talking about all of dimensions of quality in the same term. So we need to ensure that the value received by our patient in all facilities will be like well calculated, and ensuring that this value is already acknowledged by our patients. So it's very important to ensure that the quality of care from quality patient safety perspective is addressed in all aspects, in addition to ensure that another dimension, which is the efficiency, is also put in mind to ensure that the whole picture is will be more valuable for our patients. So we selected unleashing value-centric quality, and as you can see, we have like merged value-based healthcare into quality. In addition to this, the main theme will be advances in quality and infection control. Why now? Now, because you know there are a lot of weeks happening now, including quality patient safety day, which is 17th of September, and quality week in September and October as well. So we agreed that let's take this opportunity and ensuring that we will have an activity addressing all of this aspect in the same time. Actually, just to talk about the event will be like 1 day of pre-conference workshops, and we have 3 parallel workshops, including one focusing on value-based healthcare. This will be presented by the institute called Decision, and it will be presented by Prof. Fred, who is the chairman of Value-Based Healthcare Europe. So this great workshop will ensure that the attendees will be able to grasp a lot of new value-based healthcare concept, having some tools to ensure that they can start adopting some of these concepts in their facilities, and of course networking with key persons in value-based healthcare nationally and internationally as well. In the same time, we will have another workshop for infection control, which is outbreak management. And I believe this outbreak management will be like handled by 2 of our colleagues, Dr. Basim Rakhawi and Dr. Mohammed Qahtani. And both of them will ensure that our attendees will be like familiar with all advances in outbreak management. And as you know, this is like the new challenge for healthcare, not only at the branch level, it is on country level. The third pre-conference workshop will be like a patient safety leadership workaround. And this is another thing that will affect all of quality and value-based healthcare aspects, which is having all dimensions of quality implemented during the round of leadership, ensuring that the leaders are engaged with frontliners in addressing any kind of gaps in healthcare service delivery, and having this as a continuous improvement and support for our management. So these are the 3 pre-conference workshops, and then we will have our 2-day conference. One of the first day will be like talking about quality advances in digital area, and as well as analytics and value-based healthcare. So we have 2 streams parallel to each other. We will have a keynote speaker by Prof. Fred, and we will have panel discussion, actually, which is one of the very interesting topics between most of our esteemed quality directors in private and governmental sector. And we will discuss the challenges for this kind of digitalization of quality in healthcare, and in ensuring that, again, any kind of success stories can be shared with our colleagues and benefit from it to their organization. The third day will be like the infection control day, and this infection control day will have a lot of actually esteemed speakers nationally and internationally, and you can visit the website to see the names, actually. So we have big names from MOH area, in addition to governmental sector and governmental private sector and international sector, which is we have 2 guest speakers from Mayo Clinic as well. So I believe this kind of 2 tracks as well in the third day and last day will be very interesting to our colleagues in the area of infection control, which is very linked again to value-based healthcare. Just to ensure that everybody is prepared, and I do recommend that whoever will attend this event, inshallah, needs to be like aware of a very important white paper released by Daman in Saudi Arabia, talking about the roadmap of value-based healthcare. Why I'm referring to this document? Because it is a base of any kind of movement from private and governmental sectors towards implementation of value-based healthcare. And actually, you need to be focusing on this paper and ensuring that that staff who is working in quality infection control or any kind of administrative area, in addition to our physicians, nurses, are equipped with the skills needed to adopt this kind of concept. So I'll go through 2 slides only, again, about this white paper. And of course, I'll be happy if any of our colleagues have any questions. This will be great as well. So value-based healthcare, by definition, the value is the health outcomes that matter to patients, divided by the cost of delivering healthcare. And here we need to ensure that the health outcomes is not only measured by our clinical KPIs, which is internally discussed and analyzed by our colleagues and the leadership positions or in clinical, non-clinical areas. The outcome that we are talking about that matters to the patient. So it's very important to ensure that whenever you have this kind of holistic approach of measuring the outcomes towards the patients from their eyes. So there are a lot of concepts here which is start to be like more prominent. It is not a new thing for healthcare, including something called PROMs, which is patient-reported outcome measures, PREMs, which is patient-reported experience measures. And I believe most of the healthcare sector now is measuring both of them, but maybe not on the scale of having this as a prerequisite for any kind of movement towards improving the value for healthcare. PROMs is something we know it was like utilized in a lot of disciplines, including oncology, other areas like orthopedic, especially in the major surgeries that affected the mobility of the patient. Why it's very important? Because it will measure the quality of life rather than the healthcare outcome. So we did the surgery, it was very successful. There is no surgical site infection, but again, we need to measure how this helped the patient to go back to her daily activities and ensuring that he is not suffering of any kind of challenges in his quality of life. This can affect, then adopted in all specialties actually. So if I'm talking about pediatric patient, sorry. So if a baby has an asthma, as I'm saying always, it is not only to treat his asthma. You need to ensure that this baby is engaged in his day-to-day activity with his peers, and this is what we call quality of life, and it should be measured, ensuring that the family and the patient is not suffering from any challenges in this area. So if I'm talking about health outcomes, I'm not talking about only clinical outcomes, infection control outcomes, and others. We are talking here about, again, health outcomes that matter to the patient. So this should be like in our mind when we talk about value-based healthcare. Of course, cost is something very crucial, and all of us know that when we have this kind of epidemics or challenges to the healthcare system, the resources is something we need to ensure that we are balancing and utilizing in the proper way, in balanced way. So having this kind of focus on the cost of delivery of healthcare is again crucial for ensuring that we provide the right value to the patient. So having a patient with the highest antibiotic or the most potent antibiotic will give a clear outcome for the patient, that the patient will be like cured from this kind of infection. But if we look at the other angle, which is the efficiency and the other effect of antibiotic on the community. So again, it's like a holistic approach to healthcare. It's not only related to the outcome, it's related again to the efficiency of this. So this is a golden key for developing any kind of approaches towards the value-based healthcare. What are the skills and what are the topics that everybody needs to be prepared for? And of course, we have a lot of initiatives, governmental and private in Saudi Arabia, covering these areas and ensuring that it will not be like sporadic or haphazard movements. It will be like like balanced and planned movements towards implementing value-based healthcare. So as you can see, we have informatics, benchmarking tools, payment process, and delivery organization. So if I'm talking about a healthcare professional that is working in quality and infection control and administration, or even physicians, they need to know what are the topics or skills that they need to adopt to be ready for this kind of movement, and accordingly the whole organization will be successful in implementation. So from informatics point of view, you know that a holistic approach in having unified healthcare record for our patients, having different analytical tools to measure the outcomes of the patient, having triggers for the patient safety, having this kind of using all kind of digitalization to ensure that we are ready to have a better outcome, ensuring that we visualize all kind of measures, clinical, non-clinical, cost. So without this kind of preparation for towards informatics, digitalization, I believe a lot of healthcare providers will be out of the industry if they are not ready for. All of us know Nafis, and Nafis is a portal that will enable the regulators to see and measure not only the claims from cost perspective, it will be like from clinical outcomes as well. And I know that all of you know that this is like an aggressive implementation of different kinds of informatics. Benchmarking tools is a very important to ensure that whenever we do any kind of activities, this kind or measuring our outcomes or processes in healthcare, we need to have this kind of benchmarking. Benchmarking is not only to measure and say that this is the highest and this is the lowest. It's something to ensure that we can address any kind of gap in healthcare. So this kind of benchmarking tools is started to be like evolving, including PREMS, PROMS, CROMS, and others. And I believe by time we will have like transparent reports of health outcomes based on facility and industry as well. The third pillar is a payment, and I know that the payment will be regulated by government. And why we do have this kind of payment process can affect us is whenever we have any change in the payment model will affect the way that we deliver the healthcare, and we need to ensure that we have the preparation for this. And I'll talk about different ways of payment and how this can affect the delivery in the next slide, and how healthcare workers, including patient infection control administrators and infection control, needs to understand that this payment, they need to prepare for any kind of payment model that can affect their service delivery, in addition to having more efficient way of handling this kind of services delivery. The fourth one is delivery organization, and to ensure that all of the pieces of the healthcare or value-based healthcare is implemented, we need to ensure that the patient journey. We are not talking about episode here that the patient will come to the facility and according to this, the patient will take a service and go out. It is a seamless process of continuum of care. So we need to ensure that we are dealing with the patient rather than episode or activity that he will do and go. So a lot of measures and a lot of services that should be adopted by all healthcare organizations, including population health, including primary healthcare, and how this part of healthcare is very crucial, not only from governmental point of view, it is also by private health sector. And we know that there are a lot of movements towards having changing the healthcare delivery towards gatekeeper, which is family physician and primary healthcare, and ensuring that we will not have this kind of burden on a specialized care, which is a needless and not needed like burden. And this will ensure that whoever need a specialized service will take it in timely manner. I promise that I not take more than 15 minutes, but actually this is very crucial to present as well. So when we talk about payment model is something, again, all of our healthcare workers needs to understand. So financing of healthcare is the third pillar of the golden key of healthcare system. So we know that the golden key of golden triangle, sorry, for healthcare system is talking about quality of care, access of care, and finance of care. You cannot measure only, you cannot focus only on quality of care or access of care without the finance. So this kind of payment methodology is very crucial to ensure that we deliver safe healthcare, efficient healthcare to our population. And this is why every country will choose one way or another of different ways of bundled payment or unbundled payment. So as you can see, there is a lot of methodologies, including block budgets, fee for service, pay for performance, bundled payments, and as you can see, this kind of capitation per period, per case. And I am sure that all of you are like subjected to some of these payments. But the concept here that you need to be ready for this. How the nurse or the physician or the quality professional, infection control professional needs to understand this. Needs to understand that we have a limited resources in any country. Actually, limited resources means we need to ensure that whenever we budget for healthcare, this budget for healthcare needs to be balanced. So it is very easy to just be very subjective. Whenever we have a pain in any area, we will pay for it. But actually, we need to ensure that we have preventive measures of having any kind of disease burden, in addition to have balanced way of payment. So we will encourage efficiency of healthcare, and in addition to great outcome for more safer healthcare. So if I know that, as an example, just to ensure that everybody on the same page, if I know that I'll take only 1,000 real for a diabetic patient, so I have a lot of thoughts when I have this figure. One of them is let's ensure that we will not provide the patient without any kind of expensive care, whatever he needs or not. And this is not the right way to go. You need to ensure that you have efficient processes, prevention of care, and in addition to this, ensuring that you have clear clinical outcome that govern this kind of delivery of service. Other organization will ensure that they have balanced approach to this kind of payment model, and they are prepared by having a lot of protocols in place, proper triggering process to ensure that the patients will have the proper length of stay, the proper OR time, proper selection of care. And actually, appropriateness of care will play a big role here. So appropriateness of care means that the patient needs to be, or the service provider needs to ensure that he has a proper justification for the care of the patient. He will do the right prevention of any kind of disease to ensure that we will not have a patient visit to the hospital. We will prevent readmissions. We prevent escalation to critical care, and all of this will ensure that we will get benefits in addition to safer healthcare. I talk a lot of I exceeded my time. I'm sorry for that, but again, to ensure that everybody is prepared, you need to see this kind of phases that already started in different dimensions. So as we said informatics, benchmarking, payment, delivery, and this kind of phases started already. And I believe we start to feel this kind of a change in many aspects. So in each one of this, you can see something you need to start reading about, training about, or addressing this in different ways. So if I'm talking about Nafis, only Nafis, or PROMs or PRAMs or whatever statement, as you can see here, clinical audits, clinical coding, all of this are skills, are translated into skills, knowledge, or plan. So you need to prepare yourself, your organization towards this, ensuring that everybody are prepared. And what I can say only that having this kind of initiative from Saudi German Hospital to have this great conference, actually, inshallah, on 25th, is something to network, to discuss, to share success stories that are implemented in Saudi German and other hospitals, to ensure that we are like working together to address all of this kind of gaps in healthcare, and ensuring that this kind of great plan or great strategy happening in healthcare will be like presented easily. So see you soon, inshallah, in 25th of September, and we hope, inshallah, we will be ready for you there, having all preparation to ensure that this conference will be of benefit for you and for your facility as well. So thank you again, and I'm sorry if I exceeded my time. If any questions from the attendants, please write in the chat, and if not, thank you for your attendance, and I hope, inshallah, to see you on 25th of September.